So we get into lab investigation in a patient with cholecystitis, and it's wonderful, you know. So labs in a patient with cholecystitis, we have said this before, and I'll say it again. Most of the time, we are looking for a patient whose leukocytosis is elevated with increased number of band forms. That is the left shift, okay? And then elevation in serum total bilirubin and ALP are not common. Doctors, let me say it again. They are not common. I'll say it again. A patient with simple acute cholecystitis does not usually have elevated ALP and total bilirubin. As soon as you see a patient with right upper quadrant pain with elevated ALP and total bilirubin, I want someone to give me 3 diagnoses that they'll be thinking about. We've already reviewed it, but I want you to say it again so that I re-emphasize it. If you see a patient with suspected acute cholecystitis, but then you see that there's ALP elevation, there's bilirubin elevation, what are some of the things you're going to think about?
Acute cholangitis,
Cholangitis, beautiful. What else?
emphysematous cholecystitis,
Beautiful.
Mersey syndrome.
Beautiful. So, as I said, laboratory investigations don't be tricked in the board exam. Most of the time, ALP will be normal. Most of the time, total bilirubin will be normal. And then you go like, we discussed this in class. Dr. Bruni taught it. Now, so with what we just said, so this is the eureka moment. This guy is having a eureka moment. So conditions to think about if you see a patient with cholecystitis with elevated serum bilirubin and ALP levels. Number 1, biliary obstruction. Number 2, cholangitis. Number 3, choledocholitis. Choledocholitis basically means that, the bile duct itself is blocked. And then Mersey syndrome, Dr. Noor was asking, Dr. Boni, explain Mersey syndrome. Mersey syndrome means that the patient has a gallstone which has left the gallbladder and it's now impacted in the distal cystic duct, and it is causing extrinsic compression of the common bile duct. So the gallstone has left the gallbladder itself, it's gone into the cystic duct, and it is compressing on the common bile duct. That is Mersey syndrome. So 4 conditions that can lead to elevated serum bilirubin and ALP levels in the context of a patient you are thinking has acute cholecystitis. Number 1, biliary obstruction. Doctors, please write it down. Number 2, cholangitis. Number 3, choledocholitis. Number 4, Mersey syndrome.